A family trip to Colorado.
Sounds perfect.
Then a strange headache revealed something life-threatening.
A trip to the hospital out there.
Head to a medical flight to Little Rock.
And brain surgery at Arkansas Neuroscience Institute.
At St. Vincent.
Where a team of experts is ready 24 hours a day, every day.
We'd have gone anywhere in the world for the best treatment.
But all we had to do was come back home.
The Arkansas Neuroscience Institute at St. Vincent.
Welcome back, everybody. St. Vincent Dr. Friday here, and today is Dr. Brian Burton, who's in from the Women's Clinic. Good to see you.
Good to see you.
Yeah.
It's glad to be back.
I mentioned off the top that you doctors kind of get everything. Because sometimes that's the one time a year a woman comes to the doctor.
I heard it summarized the other day as a gynecologist, so kind of a gynecologist, psychiatrist all in one. So yeah, we get it all.
Let me tell you all this, right?
Right.
Okay,
absolutely.
Well, let's see what they want to ask you about today. Heather is up first from Greenbrier. Hi, Heather.
Hi.
Hi. What's your question?
Well, I am 32 weeks pregnant, and I'm starting to leak a lot of colostrum, and I'm worried that everything I've read so far has said that that's not a good thing, that you shouldn't express or leak that first bit of good milk.
That's an interesting question. I've actually never been asked that one before, which is normal in our field. We always get new stuff every day. You know, there's not anything you can do to stop it, and so at this point, you know, it's not indicative of anything bad to come. I think definitely that your baby is going to get the nutrients it needs when you do start to breastfeed. The colostrum is usually the part that comes out first when you start breastfeeding, and that part does have a lot of immunoglobulins and things that are important for the baby's immune system, but otherwise your baby's going to do just fine. It's usually nothing to worry about. So, and you always have to be careful what you read online for sure. So always go to a reputable site.
Very good. So. Okay. A new question for the doctor, but he says don't really worry about it.
Right.
Okay, very good. Thanks, Heather, and good luck with your pregnancy. Stephanie is up next from Hot Springs. Hi, Stephanie.
Hi.
Hi. Go ahead.
Yes. Doctor, I have polycystic ovarian syndrome.
Okay.
And I have done all the conventional methods like the spironolactone, and they almost killed me on the metformin, because I don't have a high A1C, and the spironolactone really threw my blood pressure down, and I cannot get off the weight. And I've had doctors tell me, as long as you have this, it won't happen. And now the cysts are actually spreading to other parts, like my thyroid and stuff like that.
Okay.
Do you have any suggestions? Because this disease is a nightmare.
It is. Polycystic ovarian syndrome is a very common illness that we see a lot of, and it's a very, very, very complex disease that involves the entire endocrine system. Honestly, as OBGYNs, we deal with this a lot, and we can do the basic treatments for it. But when you get complex, such as in your case, I think a referral to an endocrinologist, or more specifically a reproductive endocrinologist, is probably not a bad idea. Those guys spend an extra 3 years in training doing nothing but female endocrinology, and in your case, I think that's probably not a bad idea. We're good at it, we're not great at it, and those guys are great at it. So I think that's probably where you need to go next.
You would probably go ahead and send her to an endocrinologist.
Yeah, I really would, and I hate to say that, but yeah, I think that in your case, Stephanie, I think that's probably a really good idea.
With this syndrome that she has, how does it make you feel? Are you tired all the time? Or?
It's very variable. I mean, it's something the ovaries react to the rest of the body, and it's very variable in each person. You know, most women recognize it because they might have a little bit of facial hair, or they're a little bit overweight, and they can't seem to lose weight like other people. And that's one of the reasons we treat it with metformin, which is a diabetic medication that helps to treat it. And then we also use birth control pills, which clearly, if you're trying to get pregnant, you can't use birth control pills. And there's some other things that we can do to treat it. But at this point, once you're at that stage, it's very complex.
Okay, very good. Thank you. Sounds like she's with the doctor she needs to be, though.
Absolutely.
Okay, we're going to work on getting another caller on the line. But in the meantime, let's just kind of go over when women need to start going to their gynecologist and how often you think that should be done.
Absolutely. You know, there's different recommendations for different age groups. You know, a woman should start going to the gynecologist when she becomes sexually active, or she turns 21, whichever comes first. the recommendations now are not to do Pap smears until age 21 because they found that a lot of women less than age 21 got Pap smears that returned as bad or precancerous when in fact they would be normal if you just kind of leave them alone because cervical cancer is so rare prior to age 21. So if you become sexually active, then definitely you should be being screened for gonorrhea, chlamydia, other sexually transmitted diseases. And then once you're an older woman, going to see the gynecologist every year is important. There's some other conditions that can happen that we look for on a daily basis. Medicare doesn't pay for Pap smears, but every other year after the age of 65. And so some people say, well, you don't need to go but every other year. And it just kind of depends on the patient and risk factors.
Yeah, and what kind of symptoms you've had through your life
absolutely.
And all of that.
Absolutely.
Okay, we're going to squeeze in June, who's on the line from Camden. Hi, June.
Hi, how are you?
Hello, doing well. Go ahead.
I have a question about hypothyroidism. I have that problem.
Okay.
And the problem I have is lack of iodine. And when you go to the doctor, you get your blood work done, my tests come back normal.
Okay.
But I still have a problem sometimes with anxiety attacks, and I get tired quickly. My heart has been tested. Everything is fine. I have no blockage. But I do know that hypothyroidism is a problem for me.
There's
done about it.
Well, there's quite a few different tests that we can do on the thyroid, and again, this is the part of the endocrine system that is very complicated. The thyroid kind of modulates your whole entire body, and it's important to make sure that it's healthy. There's a normal test we do. It's called the thyroid stimulating hormone. We check a TSH. It can be normal or abnormal, but then there's some other very specific tests we can test for that look for different hypothyroidism, hyperthyroidism, subclinical hypothyroidism. There's a vast array of thyroid disease that can occur, and there's different tests for each one of those. If your primary doctor is testing for these things and everything's coming back normal, then those other tests at that point should be implemented to try to figure out exactly what the thyroid problem is.
One of them is underactive and one is overactive, right?
Yes, and it's very complicated. Overactive thyroidism, women are usually very thin and have their hair may fall out, they may have diarrhea, they may have dry skin, dry eyes, dry mouth, and then hypothyroidism, women are typically overweight and are very tired and very lethargic and those kind of things. So those symptoms are very different, but you can have symptoms from each one in the opposite. So we always learned in med school that the thyroid is the great masquerader. I mean, it can be any medical problem that we see, we always check for a thyroid problem.
That's one of the first things you look at.
It is, absolutely.
Very good. Well, we tested your endocrinology.
Yeah, no kidding.
Learning today, your education in that. Let's put up the information about, of course, the women's clinic, and as you can tell, they're fantastic doctors and staff there to take care of you for all of your gynecology or your pregnancy needs.
Or endocrine needs, apparently.
Apparently so. Okay, so they're over on University. There's the information right here in Little Rock if you need to call. And our thanks to St. Vincent as well for all their help sending us doctors every Friday. Thank you so much, Dr.
Absolutely.
Burton.
Thank you very much.
Have
it's good to be
weekend.
back. Thank you.